Good morning, everybody. My name is Erin Kressel, and I'm the Executive Director of the B Foundation for Brain Aneurysm Prevention. We're really excited to be here today with Mirhojjat Khorasanizadeh, who is our 2021 Research Grant Awardee. Welcome, Mir.
Thanks, Erin. Hi, everyone. Honored to be here.
We're definitely really excited to let everyone know about our 2021 research grant and get started on it. Mir will tell you a little bit about himself as well as the project. Mir is a postdoctoral research fellow with Beth Israel Deaconess Medical Center, Harvard Medical School, and his mentor and scientific advisor on the project is Dr. Christopher Ogilvie. So again, we're really excited for the work that they're doing and to tell you about the project. So to get started, Mir, why don't you tell us a little bit about who you are, your background, and how you got into brain aneurysm prevention and research?
So my name is Mir. I'm a medical doctor. I graduated from Tehran University of Medical Sciences in Iran, Tehran, Iran, 3 years ago. My parents live in Iran still, and my sister lives in Canada studying her PhD. I got into brain aneurysm research in the middle of my medical school years, and I was always fascinated with the function of brain and neurologic diseases. But what specifically made me curious about brain aneurysms was actually something that happened while I was working on my MD thesis with one of my professors who was a neurosurgeon. So he told me a story about a patient that he had while he was serving the very underdeveloped areas of Iran. A patient who had a very difficult to treat brain aneurysm, and apparently no one in Iran knew how to treat that aneurysm. It was basically untreatable in their opinion. So unfortunately, for many reasons, the scientific community in Iran sometimes is more isolated than the rest of the world. So there is some huge gaps in training. He told me that we even asked one of his former mentors in Canada to come to Iran and treat that patient. And actually, that person agreed to come there without getting paid. But unfortunately, the patient could not be treated. So that triggered something in my mind that this is a very serious disease and there are serious shortcomings in treatment of it, because not only no one in huge country like Iran could treat it, but also on an international level, it's still a huge challenge. So that's what triggered me to get into this field. And the more I read about it and the more I did the research, I realized it's still a huge challenge all over the world. And especially since in the United States, 7 million people, as you know, have unruptured brain aneurysms, and 30,000 people have an aneurysm rupture every year. And unfortunately, half of the patients die before they even get to the hospital. So I think there's an unmet need for research in brain aneurysm. That's why it's my main focus right now.
Thank you so much for sharing that story. It's very aligned with what the B Foundation's mottos are, to be courageous and go after unmet needs. I know it's probably significantly understudied in underdeveloped countries, but even in the developing world, as you know, here in the US, it's a significantly underfunded area of research. So obviously that's why we're passionate to be doing it and love broadening our research community with people like yourself that are really committed to this unmet need. So thank you. Let's talk a little bit about the project that we're funding and that you're working on. The formal name is, as you know, is the Correlation of Circulating Endothelial Progenitor Cell Levels with Outcomes of Intracranial Aneurysm Flow Diversion Treatment. If you could break that down for us, just tell us what exactly that means and what you'll be studying.
So as you know, there's a whole relatively new field in treatment of unruptured aneurysms called flow diversion, which means that we put in a device inside the vessel that has the aneurysm. And over time, the walls of the device will get endothelialized, which means that vessel walls form on the site of the device. And so the aneurysm is isolated from the vessel that is diseased. And over time, the aneurysm is thrombosed and after a while completely occludes and goes away. So that's the idea behind flow diversion. But unfortunately, despite the huge benefits that flow diversion has had in the past decade, but unfortunately still a significant number of patients do not benefit from the treatment. So the number is variable in different studies, but it ranges from 15 to 40% of the treated patients, which is a significant number. And the problem is that we still don't know why. We really don't know why a significant subset of patients do not respond to flow diversion treatment. There has been many studies by both our groups and many other research groups in order to try to identify the causes of treatment failure. But there has really been no clear-cut finding. For example, there are many factors that have been suggested to play a role. For example, age, smoking, technical factors like device malposition, and also use of certain medications, maybe anticoagulation, but they cannot predict treatment response accurately. For example, there was an interesting study about 4 grading systems or grading scales that try to predict response to this treatment. 3 of them were even worse than random guessing. The best one only had 38% positive predictive value, meaning that it was wrong like more than half of the time. So we basically don't know why some patients do not respond. Dr. Ogilvy, the genius that he is, he thought that maybe it has something to do with endothelial progenitor cells. Endothelial progenitor cells are a kind of stem cell that are produced in the bone marrow and then circulate in the peripheral blood. And when you put the device inside the vessel that has the aneurysm, these cells go into the device walls, integrate over there, and start proliferating, and they produce the vessel wall that is supposed to isolate the aneurysm. So the hypothesis was that maybe patients who do not respond to this treatment is because they don't have enough number of endothelial progenitor cells in their blood, or EPCs. We also know how important endothelialization is for occlusion of the aneurysm. And we also know from cardiology studies, studies in patients who have coronary heart disease, and they also have received stenting. We know from those studies that the numbers of EPCs may play a role. So we put all of these together and had this idea to measure the number of EPCs in blood of the patients who are receiving flow diversion and see if that correlates with the outcomes of the treatment.
That's really neat. So if I can try and summarize what the project is. So as many people know, the B Foundation funds projects that are focused on prevention. So in this sense, flow diversion is a very viable and promising, when it works, treatment for stopping brain aneurysms from rupturing when they're found pre-rupture. What this study is doing is identifying why in many cases it is not working. And so I'm hearing that anywhere from 15 to 40%, it's not working, but it's very hard to identify for which patients this study is not working. And the hypothesis is these progenitor cells that help with endothelialization might be a cause for why it's not working. How did I do?
Accurate. Exactly.
Well, great. And so I also understand this is definitely an area that has not been looked into before.
Yes, unfortunately, everything that we know about the mechanism of action of flow diversion comes from animal studies. So there have been studies in like rabbits with artificially produced aneurysms that have shown that EPCs have a role in the mechanism of action, but this is the first study that's trying to look at this in actual humans. The interesting thing about it is that we found a non-invasive way to do this, just by doing a blood sampling, which is not going even to be an additional procedure for the patient, because while the patient is receiving the flow diversion procedure, the femoral artery is being catheterized, we can just use that blood to measure the EPCs without any additional burden to the patient.
That's great. And so if we were to think of what would be the benefits of this study, if it was successful and we found that this is in fact a reason why it's not being successful, or potential outcomes that the neurology community would better identify who is going to benefit from flow diversion. And so you can make better decisions on what treatment to provide to unruptured aneurysms. I'm assuming that could be one path, but also, is there a path of how you could boost progenitor cells and increase endothelialization?
Exactly. That was some very impressive rational thinking. Yeah, exactly. So just to reiterate, the first obvious use of the results would be to try to select patients who are more likely to respond to the treatment. So currently, we use an all-comers approach. So if the patient has the indications for flow diversion, which are like very wide and vague, the patient is selected to receive it. But what we are hoping to achieve is precision medicine, which means you individualize the treatment to the patient and select the patient who is more likely to respond. So this is the first application. The other one, as you also guessed, is to devise plans or strategies to improve endothelialization in patients who are more likely to have a poor endothelialization apparatus, for example, the elderly patient. And that could be done potentially through medications or also changes in device design. So there's this idea in cardiology for drug-eluting stents or EPC capturing flow diverters, which means that we use certain antibodies or peptides or other substances on the device so that the EPCs can integrate into the device better, easier. But that has never been studied in brain aneurysm. So hopefully, if the outcomes that we expect to observe are observed, actually, it has the potential to revolutionize aneurysm treatment.
That's amazing. Oh, thank you for kind of breaking that down. I think there's a clear understanding of how important this study is and how it's just one more step into broadening the landscape of preventative research. Thank you for being here. We're really looking forward to learning more about this study. And I know our community of supporters are really excited to be able to provide this grant to you. And we hope that we'll get a chance to meet in person at a future event. Any other final words to our donors?
Yeah, I just wanted to express my gratitude to the B Foundation and your dedicated donors. I follow you on social media. I've been following you for a long time, and it's really impressive what you have been doing for both brain aneurysm education and also funding research for many years. You're doing a great job, and we're really honored to receive this award, Dr. Ogilvy and me. We're so excited to do this. And I also have to thank Dr. Ogilvy, my mentor, the brilliant idea that he had, and he gave me the opportunity to work on it and expand it. So thank you very much for doing this, Erin.
Absolutely. So on behalf of the B Foundation, we're just really excited to have you now as a member of our research community, and we're looking forward to the study. And thank you to Dr. Ogilvy as well as Beth Israel. So great. All right. We'll talk to you soon.